We're going to talk about the immune system. This is the most important or interesting virus we're talked about lately. This is a coronavirus. See all these spikes, and I will just mention briefly, you make antibodies if you get coronavirus to actually something in the nucleus. If you get a vaccine, you make antibodies to these spikes. Doesn't matter, either way, the virus is dead. Okay, types of immunity, we have the innate defenses and the adaptive defenses. Innate, you're born with, they're ready to roll. Skin is the first one, and mucous membranes. Surface barriers, you know that if you break the skin, it can get infected. Same thing, if you bite your mouth, you get a little infection in it. That's why you got to be careful when you eat. Don't eat too fast. But you're born with these defenses. There are internal defenses that are innate, ready to go. Phagocytes, these are things that eat things that need eating. Examples would be macrophages and neutrophils. Natural killer cells, inflammation, antimicrobial proteins, and fever. Now, your adaptive defenses actually respond to specific antigens. An antigen is a bad guy. Any kind of organism that doesn't have a marker that's you. And humoral immunity is made by B cells. This is antibody immunity. The body humors are the liquids in the body. This comes from the old Greek philosophy. The word comes from the old Greek philosophy that the four humors of the body were what kept you in balance. I don't remember what the four humors were, but four liquids. But anyway, this is in the bloodstream, lymphatics, but they're made by B cells. And B cells are lymphocytes. They mature in the bone marrow. Cellular immunity actually attacks cells such as cancer cells, cells that are infected by pathogens, cells that are surrounded by antibody because they're full of antigens, and these are T cells. They're all lymphocytes, all blood cells start in the bone marrow. But T cells then travel to the thymus, which is a sort of squishy, mushy organ that's a lymphatic organ. Where a lymphocyte is hard and round, this is squishy. And it's over your heart, under your thorax, only active in the early part of your life. And then as you get older, it's just there, shrivels up. In fact, if you have heart surgery at the age of 72, the surgeon's probably going to pick it up and throw it in the trash because it's just in the way and doesn't do anything. The innate defenses, these are non-specific in general. We talked about skin and mucosa, physical barrier. Also, the pH is being slightly low, discourages a lot of organisms from growing. Mucus traps organisms. When you catch a cold, your nose runs, and it runs, and it runs, and you wish it would quit running. Well, when it's running, it's actually washing away organisms. So that is an effective defense. Now, macrophages are cells that phagocytize invaders in tissue. Your monocytes become macrophages when they leave the bloodstream. Neutrophils phagocytize invaders in blood, but they also leave the bloodstream and come into the body, come into the tissues and kill stuff. Now, how phagocytosis happens? First, you have to get adherence of the pathogen. The phagocyte has to adhere or stick to it. You can't catch something if you don't stick to it. And so that's the first thing. And this is one thing antibodies do, is they make organisms actually more sticky. I always like to use reference to when I was a kid, we had these greased pig chases. And you had the greased pig and you chased it and you caught it and you couldn't hold it. Well, that's kind of what the snot in your nose is doing to the pathogens. But the pathogens are slick too, and they try to get away from the phagocytes. And pathogens being bad guys, phagocytes being good guys. So if you could take a stick, let's just take a toilet plunger in a big harness and attach it to that greased pig, then you could catch him. Well, that's what an antibody would do, is surround this germ here so that it can adhere easily. The phagocyte can adhere easily to it and then eat it. So attaches to it, forms a pseudopod, which is a little vesicle. First it goes around it, then it has this little vesicle it makes, and then the vesicle connects to a lysosome, which has enzymes and acids in it that destroy the pathogens, and then they spit them out, exocytosis. So that we just ate two lovely pathogens here. Okay, natural killer cells are large granular lymphocytes, and they just target any kind of cell that lacks self receptors. So they're abnormal, cancer cells, virus-infected cells, and they secrete chemicals that also enhance the inflammatory response so that you can bring in other cells to help attack the cancer virus. Now, inflammatory response happens whenever body tissues are injured or infected. Helps prevent the spread of damaging agent, disposes of cell debris and pathogens, sets the stage for repair. Now, I want to take a quick diversion from this PowerPoint for a minute and mention inflammation. It's the first stage of tissue repair. So if you do surgery on a patient or you're taking care of a post-surgical patient, we all know that cortisol stops inflammation. In fact, if you give prednisone, it stops inflammation. Well, cortisol is released when a patient is in pain. So if you give them their opiate painkiller, then they're going to have this inflammation is going to go ahead and take place. They don't have the cortisol rushing through, and they can actually repair tissue. If you don't give them the painkiller, the opioid, then they're going to have a slower tissue repair. Been controlled studies done on this. Patients who've had good pain control get better much more rapidly than ones who don't have good pain control. I even know of one person who they did a hysterectomy on, put an epidural in after the general anesthesia. After 24 hours, it was taken out. She never felt any pain, and she was back with work in just no time. Okay, and another thing that people use instead of opiates are NSAIDs. Oh, we'll give them some ibuprofen. That'll fix it up. What does ibuprofen do? It causes bleeding. I think that's an atrocious excuse for pain relief after surgery. Now, I'm not advocating giving all your patients opiates and having them out on the street taking heroin. No, no. I'm talking about post-surgical only. They're not going to get addicted if they're in the hospital 3 days and then you send them home with 10 pills. They're not going to get addicted to the opiate. Okay, signs of inflammation: redness, heat, swelling, pain, sometimes impairment of function. Okay, this is a lot. There were a lot of slides I dumped just for to save time. He's injured the tissue on this piece of glass, and this tells you always put glass in a cardboard box before disposing of it so someone else won't get cut on it. But tissue injury does several things. The damaged tissue releases chemical mediators, histamine, complement, kinins, prostaglandins, and these cause several things. Dilation of arterioles, which let more blood into the area, and that increases the temperature and metabolic rate of the cells because of heat. You also get redness. Bringing more blood in brings more healing factors in. So, but also You get pain from that. Increased capillary permeability. So the capillaries are going to leak fluid, and that fluid is called exudate. Protein rich, it's not just plain plasma, it's just this extra protein. And that causes swelling, which causes pain. And it may limit movement of a joint, for instance. Now, these same chemicals attract neutrophils and monocytes to the area. This is called chemotaxis. We'll come back to this in a minute. Let's go down this row. Capillaries leaked clotting proteins cause you to wall off the tissue surrounding the area. If it's on the surface, that's fantastic. You're going to get rid of the infection. If it's deep, you may actually get surrounding of the tissue and get an abscess. Tuberculosis is an example. You wall that tubercle, that's why it's called a tubercle, you wall that infection off. Any kind of stress lets it break down and you start coughing up blood and tuberculin germs. If you're ever in the area where an abscess is to be lanced, pull your hair back, put on a mask, wear gloves, 5 lab coats, PPE, and then stand to the side. I speak from experience. Okay, now, tissue injury, leukocytosis inducing factor is released from damaged tissues. That causes leukocytosis. That means you make more white blood cells in the bloodstream, which is good. And then they're going to migrate because of these chemotaxis agents. They're going to migrate to the injured area. They're going to stick to the edge, margination. They're going to crawl through, that's called diapedesis, crawl through the capillaries. And then they're there to phagocytize the germs, and it clears the area of debris and yuck. Now this says pus may form. Pus is made of white blood cells, that's why it's white, usually. Dead flesh, bacteria, or virus particles, whatever happens to be in the area. Stuff you don't want in your hair. Okay, this is showing the innate defenses. You had the external was the skin, you got a little nail in it, so now the internal defenses. Inflammatory chemicals are going to cause leukocytosis. Now, you see these neutrophils are starting to marginize. They're coming to the edge of the capillaries, and then undergo diapedesis. They squeeze and flatten out and ooze themselves out through into the tissue. This reminds me of hamsters. Have you ever had a pet hamster? When my daughter was like 5 or 6, she had a pet hamster. By the way, all hamsters you buy are female and they're all pregnant. I don't care if they're newborn, they're still pregnant. That's just life. Don't buy a girl hamster because you can tell the males pretty easily if you look behind them. But anyway, they ooze out. Now, why I say it reminds me of hamsters is I remember waking up in the night, seeing these 2 little red glowing spots in front of me. I was having a nightmare about demonic forces. I see these 2 dots. Pretty terrifying. Turn on the light, and this little hamster twitching its nose because it got out of its cage, got lost, didn't know what to do, knew that I fed it, came in here and got me to take it back to the cage. Okay, chemotaxis, your little hamsters, your neutrophils, are drawn to the area where they can phagocytize. These are germs. Now, interferons and complement are released also by that general damage, cells that are damaged, and they may attack microbes directly or hinder their ability to reproduce. Interferons are antiviral. They reduce inflammation in general, and they also activate macrophages and natural killer cells. So a cell that is damaged, that has a virus in it, releases interferons. and it may die, that cell may die, but it releases these interferons so all the other cells know not to let this virus replicate, and so you get less viruses. These are used for genetically engineered organisms that make interferons, are used as antiviral agents for hepatitis, genital warts, and I don't know what else. Also for multiple sclerosis treatment. However, multiple sclerosis is said not to be caused by a virus. Either it is caused by a virus or it's just going on this reducing inflammation thing, which it's doing. Complement is major mechanism for destroying foreign substances, and it ramps up all of the inflammatory response. It directly kills bacteria by cell lysis, and it enhances the entire fever is a systemic response to microorganisms. So damaged cells attract leukocytes, macrophages, neutrophils into the area, and they secrete substances called pyrogens. Pyrogens reset the body's thermostat upwards. So normal now maybe 104. And if it's really high, it's really bad because it's dangerous. A moderate fever can actually decrease organisms' replication. So, and also increases your metabolic rate. The adaptive immune system is specific. Each germ has a specific response. It's systemic. The whole body is called into action. And it has memory. And there's two parts of it, the humoral and the cellular. Humoral is antibody mediated, and this is involves B cells, which mature in the bone marrow. Cellular immunity involves T cells, which mature in the thymus. Okay, antigen is a bad guy. It's something that can provoke an immune response. Most are large, complex molecules. They're non-cellular. And to be a complete antigen, they have to be able to cause an immune response and react with antibodies released by that immune response. Any kind of foreign proteins, polysaccharides, lipids, nucleic. Now, a hapten is an incomplete antigen, and I remember being halfway asleep in a physiology class when they mentioned this. I said, why would you have a partial antibody? Well, what they do is they're not immunogenic in themselves, but they attach to your skin or whatever body part, and then they mix with your own chemicals, like poison ivy is a classic example. You get it on you, you don't break out immediately, but it starts soaking into your skin, combining with your own body proteins, and then you get. Okay, when you have a vaccine developed or when you're mounting a normal immune response, you don't have to attack. This is the antigen, this is the bad guy. You don't have to attack the whole bad guy. You just have to attack an antigenic determinant. If you attack and kill this, kills the whole cell or the whole virus. Same thing, this or this. So when making vaccines, generally they choose an antigenic determinant that they can make, replicate, grow, whatever, and or make you grow in the new viruses. And therefore, you just react to one little thing. Like if you get coronavirus, the disease, you're going to produce nuclear antibodies that respond to the nucleus of the antigen. If you get the vaccine, you're going to make antibodies to the spike proteins. You remember the first picture we had all little spikes on the outside of it. Just, tons and tons of little spikes like that. So if you get a vaccine, you're going to make antibodies to those spikes. It doesn't matter whether you have nuclear antibodies or spike proteins. they still prevent further disease. Okay, self-antigens. This is your major histocompatibility complex. When they say they got to look for a tissue match, that's what they're talking about. If you don't have the same major histocompatibility complex on the surface of the cells, that transplant is. Types of lymphocytes: B lymphocytes or B cells are involved in humoral immunity. T lymphocytes or T cells are involved in cell-mediated immunity. Now we have antigen-presenting cells. They don't respond to specific antigens. They are kind of the auxiliary, the cheerleaders of the immune system. What they do is they see something that's non-self and they eat it. So I'm trying to find my pen here. So let's say where'd my pen go? There we go. It's not where I wanted it. I'll try it right here. Okay, they find this antigen and they eat it. Yum. Then they take at least part of it, and I call it running it up a flagpole. So it's just sitting there. And a B cell or a T cell says, "Oh, whoa, George over here is telling us we've got bad guys." And so we go and find bad guy B lymphocytes that are able to respond to that specific antibody. Okay, B cells are called B cells because they do their maturing, their finishing, their schooling, they're ready to roll in the bone marrow. T cells mature in the thymus. When lymphocytes mature, they have to be immunocompetent. They recognize and bind to a specific antigen. Self-tolerant. They don't attack you, we hope. Now, a naive lymphocyte are unexposed to germs. B and T cells are exported to lymph nodes, spleen, other lymphoid organs, so that you now have a lymphocyte that's ready for the germ it's made to be. T cells, again, they mature in the thymus, and they have negative and positive pressures. They must recognize self and must not recognize self as bad guys. B cells mature in bone marrow, and if they're self-reactive, three things can happen. They may just be inactivated and they're basically, die out. They may undergo editing, they're fixed, receptor editing, or they may be eliminated by apoptosis and total clonal deletion. That means they don't just kill that cell. Your body kills a cell, it kills its babies, its grandbabies, and its grandbabies beyond that. Keep in mind, they're just lymphocytes. Now, lymphocytes make up to a billion different types of antigen receptors, coded by 25,000 genes. And then you can switch these around by genetic recombination, and the genes determine what foreign substances that your immune system will recognize and resist. And that's pretty amazing that we're coded for pretty much every germ there is. We've got the code on these lymphocytes to be able to respond to them. Okay, antigen presenting cells, these are the ones I mentioned. They eat or engulf antigens and then present the fragments of those antigens on the surface so you recognize them. Okay, humoral immune response. This is antibody. Okay, you're invaded by a virus or bacteria. Now, the first encounter is going to take a while because you haven't seen it before. It occurs in the spleen or a lymph node, and if it's a B cell, you're going to get antibodies produced. That's not where it's supposed to be there. Antibodies produced, provokes a humoral immune response. B cell is activated, and you start to make, it starts to clone itself over and over. You get, division, division, division. And these have the same antigen-specific receptors. Now, it requires T cells, T helper cells, to start this whole process up. But the clones and the clones and the clones start making it. Most of them are cloned, and they're called plasma cells because they produce antibodies at about 2,000 molecules per second. That's kind of a lot of antibody for 4 or 5 days as they play out. And if you still got the germs, you still got more clones, and you keep making more and more and more. Secreted antibodies are going to circulate in liquid, blood, lymph. They're going to bind to antigens and mark them for production. Those who do not become plasma cells become memory cells. So the next time you see that germ, you're ready for it, and you get an immune response. Okay, here's an example of a chart here. First exposure to antigen A on day 0. Well, it's probably 5 days out. You finally got a good response, and you go and you make these antigens right up here to the laser pointer. Make an immediate response, and the germs are killed, they die out. Now you're exposed again. All these memory cells are ready, so within a day, whoo, you get a ton of antibodies, and you just aren't going to get sick this time. Now, this is what vaccines are going to hopefully do, is the vaccine is this hump. When you get the actual germ, you're ready for it because you've been exposed to an antigenic determinant that lets your body know that that's a bad. Okay, types of humoral immunity. And I want you to look at this slide 52 times, and you do have copies of this PowerPoint plus about 1 million slides that I didn't want to talk on. Active and passive. Active means your cells are making stuff, doing stuff. Naturally acquired, you got the germ. Passive, artificially acquired, this is still active immunity. You got either the vaccine, or it's either dead or just a little piece of one, or modified live. They call them attenuated pathogens. And the flu vaccine has a bad rap because back in the 80s they were using modified live vaccine, and some of them reverted to back to the natural flu, and it's bad to get a shot and it gives you the flu. The flu shots, now I'm not talking about the nasal spray, but the shots they give you now are absolutely not whole pieces of flu. They cannot give you the flu. They're dead. They're not even a whole piece of flu. It's like scraping an armadillo off the road and telling him to walk. He's not going to. He's dead. So you can't get the flu from a flu shot. Now, the nasal spray was modified live. They took it off the market last year. I don't know if they fixed it and put it back on. Not because it was making children sick, but because it was not working. Okay, so naturally you got the germ. Artificially you got the vaccine and hopefully didn't get sick. Now, passive immunity is different. You never got the germ. Natural comes from antibodies. You get these from dear old mom. Now, can be in the human, they go through the placenta. So an infant is born and it's got antibodies, all the antibodies she needs to start off, or he. And also in the milk, but they only cross the gut barrier just the first few hours of life. And then you still get antibodies in the milk, but they just coat the mouth and gut, stomach, gut. They probably provide some protection, but they're not in the bloodstream. Now, artificially acquired passive immunity is an injection of gamma globulins. These may be used, say for instance, you're exposed to rabies. You've never had a rabies shot before. They will take hyperimmune serum from somebody who had rabies shots before, and they will inject that directly into the bite wound. And apparently it's very painful. Now, I've had rabies shots 4 times. Fortunately, the first ones before they started using gamma globulin. because once you've had the series more than once, they're not going to have to bother with that. Last time I got bitten by a rabid animal, I just had to go in like late that night after work and get the rabies shot, and then go back like the next Wednesday morning, so Sunday night, Wednesday morning, and get another rabies shot. And I had to explain to the nurse how to mix the vaccine, and that was really scary. Anyway, she wasn't her regular job, and she was from a different department. Please learn how to mix shots. Okay, so active germs are involved. Naturally, real germs, artificial vaccines. Passive, mom, artificial, you're getting gamma globulins. And these are used for other things too, not just rabies. They're used for autoimmune disorders. They give gamma globulins. There's other things they use it for. Okay, immunoglobulins, gamma globulin portion of the blood. These are secreted by plasma cells, and they bind with a specific antigen. So they're just okay. What does an antibody do? This represents antigen. That's the germ, bad guy. This is the antibody. This is what fights the bad guys, and they're going to bind together. You may get neutralization. It just masks the dangerous part of the virus or the exotoxin or whatever it is that needs messing up. Or it may cause agglutination. They stick them all together. This is easier to eat than one little piece. Precipitation. Think about snow. These were dissolved in the bloodstream. So it's like humidity in the air. You can't pick it up or touch it. But once it snows, some of you know what snow is. I remember some one time. Once it snows, you can pick it up, make a snow cone, and eat it. So when these are all gobbled together, then they're a big chunk that things can eat, phagocytes can eat. All these things enhance phagocytosis as well as inflammation. Now, they also, antigen-antibody complex, cause complement to be released, which causes cell lysis. It just explodes the germs, which, is good to do. I had a teacher, I didn't remember a thing about these, neutralization, agglutination, precipitation, and complement. But he said that what antibodies do is they throw a rope around the germs, they bind them all up together, stomp them down on the ground, and stab holes in them. I remembered that part, but it didn't help me remember the names, so maybe it will. Monoclonal antibodies are produced in a lab, but they're made by an organism, but they're an artificial organism. They're made from more than one organism. The only one that I'm familiar with how they make is one that's used for MS, and I forget the name of it, for MS, for, rheumatoid arthritis, Hodgkin's disease, but they're made by the cell culture is a Chinese hamster ovary and a human lymphocyte B cell that makes the antibody that helps with those conditions. And they pour in nutrients and into whatever culture it is, and then they extract the byproduct that they make is the like $15,000 a month drug. Okay, T cells. CD4 cells become T helper cells. T helper cells activate the immune system in general. Interestingly enough, this is a cell that has a receptor that AIDS can attach to, HIV. If you have no AIDS or HIV receptors on your CD4 cells, you can't get AIDS. It's a very rare condition, though. CD8 cells become T cytotoxic cells that destroy cells that harbor foreign antigens. Other types of T cells, regulatory cells that help keep the immune system dampened so it doesn't destroy you while you're at it. And then T memory cells, so you remember old. Okay, back to humoral response. Antibodies are this is the simplest type of ammunition in the immune response. Targets bacteria and molecules, viruses in bodily fluid, blood, lymph, tissue fluids. Cell-mediated immunity recognizes and responds to the processed fragments of antigens that are displayed on the surface of body cells. So you remember those presenting cells that ran germ up the flagpole. And they cells that are infected by viruses or bacteria, cancerous cells. So most everybody has some cancer cells, but your immune system kills them. And then cells that are infused, like a blood transfusion, or transplant. T helper cells, they're primed by the antigen-presenting cells. They activate T and B cells and cause T cells and B cells to start proliferating, activate macrophages. Basically, if you don't have T helper cells, you don't really have an immune response. And the CD4 cells become T helper cells. So if you just think about that, HIV attaches to CD4 cells, which become the T helper cells. You can see why HIV and then AIDS is. Cytotoxic cells attack virus-infected cells, cells that have bacteria or parasites in them, cancer cells, and then foreign cells. And what they do, they have a lethal hit. They create, they have perforins that create pores, and then granulocytes that stimulate apoptosis. So they stab holes in them and explode them. Natural killer cells just recognize that a cell is not normal. It doesn't have the right major histocompatibility complex on it. It may have antibody on it. It may be stressed, and they're just going to do the same thing, perforin, stab holes in them. T regulatory cells help inhibit the immune response to prevent. Okay, organ transplants. We have autografts, which is from one body site to another. Now, this is like a skin graft. Take skin from your belly and stick it on your face where you had, a severe burn or that type thing. And we were taught the theory of it in school, but not taught how to do it when I was in vet school. But I had a guy who had a dog that got caught in a trap, and his leg was pretty destroyed, and he said it had to be fixed, and he couldn't afford to take it to the university and get it fixed. So anyway, I managed to treat it, and finally we decided it's going to have a skin graft, and I took some extra skin off the back of the dog, surgically prepped it, and you already had granulation tissue, and I did what's called punch grafts, which to me, I doodled little holes all in the granulation tissue, took tiny pieces of that skin and put it in those holes. Most of them took and they grew, and he spread and covered that dog's leg with skin, which was just fantastic, except for the fact that I didn't think about that hair grows in different directions. I didn't mark which way the hair was on my skin that I shaved. So the dog had a leg, one normal leg in the front, the other leg had hair going every which way, and it was also longer than the natural leg hair. Oh well. Okay, isografts between identical twins. You could probably give your identical twin a kidney, and it wouldn't need, they wouldn't even have to have immunosuppressants. But you're going to want it back when your kidneys go bad, and they're not going to give it to you. Okay, allografts, individuals that are not identical twins, and this is going to require immunosuppression. Xenografts from another animal, like putting a pig valve in a heart of a human. Why that works, I don't know, but it does. Okay, rejection, you're going to have first you got to have a good tissue match, and then corticosteroids, anti-proliferative drugs, immunosuppressants. Very severe side effects, but there's really not much you can do about it. Okay, immunodeficiencies. These are congenital or acquired, and you just don't have good. Severe combined immunodeficiency is a genetic defect, and it's fatal if untreated. And bone marrow transplant is the treatment. Now, I assume they can test for it before you even have babies. I know with horses, there's a test for a similar syndrome. Okay, Hodgkin's disease is cancer of the B cells, so you're going to get immunosuppression. AIDS, acquired immune deficiency syndrome. It cripples T helper cells because the HIV virus attaches to CD4 cells and you don't get good T helper cells. Weight loss, night sweats, swollen lymph nodes, opportunistic infections. It's first noticed, it may have been in the 80s, even though it existed much longer. But Kaposi sarcoma, very rare lung cancer that was happening in a lot, this was in the United States, in a lot of the gay population. And they were trying to figure out what the deal was, and they finally isolated and found the HIV. Okay, it's caused by sharing bodily fluids, blood transfusions, contaminated needles, sex, and destroys T helper cells, depresses cell mediated. Multiplies in lymph nodes, may take a few months, up to 10 years to cause disease. And it's a reverse transcriptase. So you have viral RNA, which causes a DNA to be produced, and then it splits up and causes an RNA that is the virus. Now, it has a high mutation rate, and so it's hard to get a vaccine for, and even some of the drugs. Now, this is some older drugs listed, and there are better ones. Prevention, never participate in unsafe sex. Condom use, and that means the whole daggone time, not just when you think you might need it, from beginning to end. PrEP is a daily pill you take for AIDS prevention if you intend to participate in high-risk sex. Needle sticks, sharp sticks in the hospital. Please, if you get a needle stick or a bite wound from an AIDS patient or from anybody, fill out a form so that you won't have to pay for this stuff yourself. And they will put you on prevention. And if the person has AIDS and test you, they'll test you first. Autoimmune disorders, the immune system loses the ability to distinguish self from non-self and starts destroying itself. MS, myelin on the nerves is destroyed. Myasthenia gravis, things in the neuromuscular junction are destroyed. The nerve is there, the muscle is there, but it's like when you got a battery hooked up in your car and you've got a rust where the cables come together. As long as that rust is there, you don't get a good transmission. Graves' disease affects the thyroid, type 1 diabetes mellitus, this is early onset. Systemic lupus, glomerulonephritis, rheumatoid arthritis. These are just a few examples. Hypersensitivities, the immune responds to a harmless threat, but it's not harmless to you because your body thinks it's a big deal. Antibodies are going to cause immediate and subacute hypersensitivities. T cells are going to cause a delayed hypersensitivity. Immediate hypersensitivity. Now, the first time you get this contact with this allergen, you're not going to have a response. The second time, you're going to have a response. It can be local, like you get a little bump, or it can be as in anaphylaxis, anaphylactic shock. Constriction of bronchioles, vasodilation, fluid loss, hypotensive shock, and you treat this with epinephrine because you have dilation of all these vessels, constriction on bronchioles. Epinephrine opens bronchioles and squeezes down, closes down, constricts the arteries. Delayed hypersensitivities may take a few days. It says type 4 hypersensitivities and depends on T cells. Allergic contact dermatitis, poison ivy. And I think that just about winds it down.